Good evening and welcome to our week 2 of the Sanctuary for Shepherds, where we are talking about grief support and soul care for pastors. I hope you were able to find an opportunity and time to listen to or even watch the last recording that I did. Today, in session 2, we are going to talk about the burden and challenges of vicarious trauma, or what we call secondary trauma. And once again, I would just want to make sure that we give a thankfulness to Uhai for Health, as well as the Mosaic Opioid Recovery Partnership that is allowing us to have this opportunity to talk about dismantling the unspoken. My name is Dr. Stem, just in case you haven't listened to the first one. I am a consultant and mental health professional, so I am honored to do this with all of you. So, as I mentioned earlier, we are going to talk about secondary or vicarious trauma that you absorb whilst you are helping others through grief or through difficult or challenging situations and instances. As pastors, it is crucial for you to recognize the signs of secondary trauma, and also crucial for you to be able to take care of yourself and seek support as needed. So understanding and addressing secondary trauma is also important because it will help you sustain not only your mental health, physical health, but also your compassionate, heart that you have, so that you can continue to serve your community as well as other communities, that you serve. So what we're going to do in this session is we're going to dive deep into secondary trauma. What is it? Exposure to congregants, as how it causes the trauma, cumulative effect of the trauma. We'll talk about emotional exhaustion. We're going to cover impact on personal life, professional challenges, as well as empathetic engagement. So I hope you have your diary, your journal, so that you can just jot some things down that resonate with you, jot some questions that you might have on, any particular slide or point of this conversation that we're having. And you can certainly send that to me via the group or individually, and I have all those contacts at the end of this, session that we have. So secondary trauma, which is also vicarious trauma. What is it? This is also known as vicarious trauma, which is fatigue, exhaustion. It's a form of emotional and psychological distress that can occur when you are exposed to supporting another with also their emotional and needs that they might have. In this instance, we are talking especially about supporting another through grief or through a traumatic event. For most pastors, you serve as caregivers, as confidants for your congregations. You also experience this secondary trauma at a rate that even research has not been able, to document, but it's at a very high rate that you do not just leave someone, or someone does not leave your office or leave you without a heavy feeling of having taken all of that they have, spoken to you, the heaviness on their heart, that stays with you as well. The grief that they're going through, that stays with you as well. So it becomes more prevalent and more challenging when you are supporting one after the other, bearing one after the other, going to pray for the sick one after the other, and, doing the work that, yes, you are committed to doing. But however, it also has a big toll that it has on you. So in general, vicarious grief is the sorrow that you feel when you bear witness to someone else's deep loss or death. It's feeling heavy sadness for the clients or the patients that you'll be talking to. It's when, they're crying or feeling empty, and you start to also experience the same feelings of, I don't know why I'm crying, or I don't know why I'm feeling, sad at this time. It's not uncommon for you to experience those experiences, as well. So with vicarious trauma, there's also a deep shift in your inner self that might occur, or that you might, experience. That means at some point your brain and body react to this vicarious or secondary trauma as danger that has happened to you. So then, as a result, the brain is hyper alert, where it's wanting to protect you. So you might start having bad dreams, or what we call intrusive, visions of, the person that you just buried, or the people that you just spoke to, or the person that just passed away. You might also start losing, your sense of service, where sometimes it just feels like I don't even feel like doing another funeral. I don't feel like doing, this one more time, which is normal, because then after a certain period of time, if we don't take care of this vicarious trauma, or this, secondary trauma, it does take a toll on your body and your mind. So there is vicarious grief, which centers on the loss and the sorrow that you're going through, that needs to be addressed, that needs to be acknowledged and taken care of. And then there's also the mindset, right? Where you feel yourself feeling sad, and also, having these feelings and thoughts that you might be going through in your mind. If you don't get to talk about it, then it stays within you, and you talk to yourself, and they recur as dreams, as exhaustion, as frustration sometimes, and you just find yourself short circuit, as they say it, where why am I getting easily angered? Sometimes it's because of vicarious trauma that might be happening or affecting you at that time. So, what are some of the physical signs that we see in vicarious trauma or secondary trauma? They are actually physical signs. We also have emotional and mental signs. We also have behavioral signs that you will experience. And, from the videos last week, some of these symptoms will be the same that you might experience. So, it is important to take note and pay attention to these signs. Physically, you feel tired all the time because your body uses too much energy to hide the pain that you might be feeling as well. Your gut, you might have an upset stomach, where your gut is just out of balance, causing ongoing stomach pain, nausea sometimes, you want to throw up, or just poor digestion, where you cannot eat well, or food is not sitting well. And sometimes some people eat more, and they eat a lot of food. And, also physically, you might experience a weak immune system, where you get sick more often. Why am I getting sick all the time? I'm coughing, I'm sneezing. I just don't know. I just don't feel good. Your body, it starts to ache because it's fighting germs, but at the same time, because of that exhaustion, the mental, physical, emotional exhaustion, you find yourself with a weak immune system. And pay attention to the headaches, the tight muscle that you might also experience. That's a sign of vicarious or secondary trauma as well, at some point. Emotionally, you feel empty or just shut off from all feelings. Sudden anger, you might feel mad, bitter, or irritated easily, as I mentioned. And then there's this one here where it starts to affect your memory And a lot of people say, I don't even understand. I'm forgetting things easily now. And I don't know. My husband, my wife tells me that they just told me something a few minutes ago, and then all of a sudden I'm asking about it again, and they go, wait a minute, what is wrong with you? I just told you that. So sometimes that's an indication that you are experiencing, again, secondary trauma, and it's affecting your mind at that, time. You might also have problems, or struggles focusing, again, forgetting simple things, or you feel there's this feeling of being unsafe, and expecting bad things to happen just because you've been addressing and working with others that have been experiencing all these bad experiences, it starts rubbing off on you as well, where you just start being scared and being afraid. What if it happens to me? And what if it happens to my loved one? What am I going to do? And how this, that is very common, and that happens a lot until it is getting in the way of you living your life, and it's something that is consistently happening for 6 months or more. Then please, please see your medical doctor or see a therapist and make sure that you get some help. Behaviorally, the signs are you stop talking to friends and stay alone all the time. And you just start hearing people saying, you're pulling away from everybody. What's going on with you? And you know that, you know what, maybe it is because of everything that I've been going through. You might also find yourself drinking a little more alcohol if you're one that said, you know what, I have a glass of wine here and there when I have dinner, but then now I'm drinking two glasses, three, or even a bottle of wine, then, yes, it certainly is, affecting you. And unfortunately, some people even take to drugs or taking medications or other drugs in order to numb that, pain. Sometimes, if you're driving, you don't have patience. You might even drive way too slow or drive way too fast, and then are not open to somebody saying, hey, 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 slow down. What's going on? What's wrong with you? And then you find yourself snapping, like, there's nothing wrong with me. Why are you criticizing my driving? Sometimes that's a nudge that we all need, because now you do need to take some time and also, allow the other person, if there's somebody that can drive, to drive you. Sometimes there's a delayed breakdown, where you feel fine for a long time, and then you break down over a small trigger, maybe a song, a smell, or somebody saying hello, or seeing, someone that just reminds you of the difficult loss that they had, and you be the one that starts to just, break down again, and if it affects you, again, it's normal. It goes with that cycle of grief that we spoke about, that you could be feeling fine today, and you go right back down again to the denial phase, or, the bargaining phase. It's a similar thing when we're dealing with vicarious grief, where I did that funeral. That was hard. That was tough. And you think that, okay, I'm okay to go on. And before you know it, something triggers, and you're back again to the same grief and the same exhaustion that you might have felt, during those time. Exposure to congregant trauma. Because you are a pastor, you are also going to be hearing your congregation, people sharing their personal traumas with you at all times. I'm telling you, you're just like, I am a therapist, you are a pastor. So every time people see a pastor, it's time for me to pour my heart out. It's time for me to tell them everything that's on my heart. And especially if it's during grief time, oh, there's no better person than pastor to pray for me. So you'll find that a lot, that people are always coming, to you for, grief, abuse, addiction, and any family crisis at all times. The toll on your body, your mind, and spirit can take a toll on you. So this exposure is something that, yes, is your work, it's related to your work, but what happens is you internalize and keep thinking and feeling pain and carrying the emotional pain that those that you're helping have shared with you longer. than they would carry it with them because now they've poured it on you. Now you get to carry that. And the thing about it, think about this exposure as you're not just being exposed to one person. If you have a congregation of 50 people, probably a quarter of them will come to you with their problems or with the need for support. That's 20, 25 people. And that's a lot of people. And that's why it's important, again, to take care of yourself. And I am, happy that you're taking the time to talk about this and to listen to this. There is also a cumulative effect over time, this continuous, hearing and dealing with many traumatic stories that you do can lead to the secondary trauma, which means it now beginning to affect your emotional well-being, leading to symptoms, like those that I just mentioned, but it's also a trauma that now you are experiencing trauma, such as anxiety, depression, post-trauma symptoms, because your brain gets traumatized, your mind gets traumatized, and your body, because of the emotions, the feelings, it gets traumatized, which means it gets overwhelmed. It gets to be a lot too much. Emotional exhaustion. The emotional labor that is involved in supporting others can lead to burnout and emotional exhaustion. So you may feel drained, overwhelmed, or helpless. Or hopelessness, just feeling like you're hopeless and you're helpless once you have done this work for a while. And you know what? It doesn't even matter because some people say, this is my first year in the pastoral role, and I'm already feeling overwhelmed and burnout because our tolerance level is different for each person. So it's not uncommon for a first time, pastor or minister to start feeling overwhelmed and just exhausted and experiencing this emotional exhaustion. Here's one thing that happens with, the support of others in the work that we do. Especially once you're affected with vicarious trauma, it impacts your personal life. It can really spill over into your personal life so easily, affecting your relationships, affecting your sleep patterns, and affecting your overall mental health. So you may become more irritable, more withdrawn, and actually just difficult to get along with. It's important for you to recognize that. It's also important to hear because loved ones around you will start telling you that what is going on? Why are you so angry and irritable and just easily annoyed when they say that? Now that you've listened to this and attended this session, I hope that you understand that they care, but they are your outside eyes because you cannot see on the outside looking in. Somebody else will have to see on the outside looking in and tell you what they say. And once that happens, then it means it's time to pay attention. Professional challenges. Vicarious trauma can really be a challenge professionally. It can get in the way of your professional values, your effectiveness. You may even struggle with maintaining boundaries, making decisions, or even feeling like you are accomplishing some of the goals and things that you have to do in your congregation or even personal goals that you have in your life. So that might be, something to really pay attention to. Last but not least, when we're talking about, vicarious or secondary trauma, I want to talk about empathetic engagement. Because as people that are in the serving field, we tend to pour sometimes way too much and, people will always continue to pull from you as long as you are not aware of when to apply the brakes and when to also take some help or assistance from others. Let me share with you a story that one pastor told when we were talking about empathetic engagement. He said, years ago, when I attended Bible college, We were strongly advised not to become too emotionally involved in life circumstances of our congregants. It sounded practical and easy in theory. But when I began ministry, I found the task much more difficult because as pastors, we are naturally caring people. When people hurt, we hurt. This is not only true, but also backed by scripture. So, because of this natural helper tendency, I had to establish some definite boundaries for my life and ministry, especially in the areas of pastoral counseling and caregiving, while not appearing distant, detached, and serious. I needed to communicate a healthy, honest care for my congregants. The problem was I got too attached to their problems and their stories. Can you relate to this story? Are you a pastor that also can say, you know what, honestly, I can honestly say I also get too attached to their problems and to their stories. And sometimes it's difficult for me to put boundaries because I know they need me and I know I make it better. We want you around for a long time. We want your congregants to enjoy your presence for a long time. Because if we don't, you know, allow our pastors to also take time away for self-care and for taking care of ourselves, I think as the congregants, we are the ones to lose. But at the same time, we need our pastors to also take the initiative to say, it's okay for me to take care of me. So, what are the dangers of being too attached to the congregants that you serve? It is easy to cross the fine line between pastoral care and personal involvement. This is particularly true, but not restricted to the care and counsel of members of the opposite gender. But we find that when you're serving members of the opposite gender, that's when the challenges are really extreme. So, so it is important for you to say and ask yourself, do I have boundaries on how I share and serve the congregants of the opposite sex? Because that is a danger. Emotional alignment with a client can also destroy real, genuine counsel with a caring pastor. Because then what happens is when there's an emotional alignment, the person that you're serving may begin to want more from you and depend on you more than they need to, and you become the crutch that they lean on. And that again could be a lot because you're not just serving one person, but it's important as you offer sympathy to them to notice, am I going overboard? Are they going overboard? Are they asking more, from me? With some pastors, they've said, I didn't even take a look at it because I thought that they were coming and continuing to come and being attached to the godly advice that I was giving until I realized that, this actually has gone overboard and I cannot control it anymore. Codependency is also something that you might want to be, paying attention to. The person being counseled may look to you as a pastor as, it's almost godlike rather than looking to God for making critical, decisions and also, making sure that they allow God to guide them through their life. They look to you as if you are God. It's not just the advice that they're looking for now, but they want you to be the godlike person in their life. They may feel, that if my pastor says this, then that's the way to go. But if my pastor says no, then that's not the way to do this. that becomes codependent. It becomes, something that they are now more dependent and fixated on your help more than they need to be. So it becomes an unhealthy, manipulative, relationship that will be created there. Emotional attachment can also lead to ethical misconduct, as you probably have heard or known, which is inappropriate, maybe touching or hugging or, sympathetic conversations that might be happening, but that are, seen as inappropriate, at some point. So it's just being careful. I mentioned all of this so that as pastors, again, during grief, it's difficult to remember those little things. It's difficult to remember, to keep the distances and to also make sure that, people are not taking advantage of you and people are not overly, dependent on you. So it's just, at least paying attention and making sure that you are protected, because unhealthy emotional attachments can create an environment, that literally can have you breaching the trust, of your commitment that you made to the church, to God Himself, to yourself, but mostly to the commitment if you are in a relationship where you are married or you are in a relationship, it can break that trust and breach that trust. And that will be very difficult and challenging for you to face and also resolve. So you want to make sure that you are providing a safe, protected environment when you're providing grief counseling as a pastor, that you are creating safe boundaries. So here are, a few things that you actually can also do to take care of, vicarious or secondary trauma. Have clear boundaries and guidelines of where and when you meet with those in need of your support. Travel with a co-pastor or a deacon if you're going to somebody's home, so that again, just in case they're all by themselves in there, you don't find yourself by yourself with a congregant that your heart tell you that, I don't know, I just don't feel that it's a safe thing to do. Then yes, please yield to that. Make every effort to maintain legitimate marriage or family relationships that you can trust. Talking to your spouse and say, I'm going to be seeing, Sister Mary or Sister Jane, and they want me to talk to her and just support her. But the appointment is at 8 o'clock at night, and I'm going to be at their house. And, just to run, you're not divulging anything private or confidential, but just to have somebody to run this, too. Know that again, as spouses, sometimes a woman's instinct, she might say, no, I don't think for you to go at 8 o'clock at night would be ideal, or that's a good idea. So let me, get ready and come with you. So them coming with you is also, for some people, for many people, I know, for myself as a Zimbabwean, culturally, if you see mother coming with pastor, that's even more of an honor to have both of them coming in, to pray for you or pray with you. But then for somebody who's got other intentions, ulterior motives, they don't like the fact that, pastor is coming with his wife, because I just want pastor to be by myself so that he can pray, for me. Again, you are the better judgment of that, but just make sure that you're playing it safe and you're also, protecting yourself. And spouses are usually one best way of making sure that you are taken care of. So, in addition to self-care, where again you take time for meditation, you take time for quiet time, just again to be able to deal with everything and allow yourself to let go, or allow yourself to also not carry the visuals of what you've seen and what you're dealing with. That's a good practice. But most of all, I want to encourage you, if you have not reached out to a personal therapist, to just take some time and make it your moment, because it's a private and confidential session that you'll have. Just take some time and talk to a trusted professional. That way, again, you can take care of yourself as well as this vicarious grief that we spoke about today. So again, I spoke about the dangers of being too attached, today, and then the safeguards that I just mentioned: have clear boundaries and guidelines, make every effort to maintain legitimate marriage and family relationships, and have a system of personal accountability, some pastor or somebody that you talk to about what you're about to do. As always, I have a handout that comes with this presentation. Please, take some time to just read a few things about vicarious trauma. And I have a few journaling prompts that I put at the end of each handout that you can certainly take a journal and write out. If you have any questions, please email me at drstem14@gmail.com, or you may reach out in the group or on WhatsApp. My WhatsApp is the one that says bounce back. That is my WhatsApp. Bounce back boutique. That is me. I will personally respond to your questions that you may have. I will see you in the next session, which will be session 3 of the 4 sessions that I have prepared for you.